The hip is a ball and socket joint, and a hip replacement involves replacing both the ball and the socket. In a primary hip replacement, this is replacing your own hip that you were born with, and you've lived hopefully for a long life with that hip, and you're having it replaced because you have significant pain or discomfort or stiffness caused by that hip. A primary hip replacement involves replacing the socket with either a cemented or an uncemented implant, and replacing the ball, and that can be done with a variety of means. In my hands, I use a cemented Exeter stem, which is the stem that we routinely use in Exeter, having invented the stem, and that becomes your new stem and ball. That is a primary hip replacement. A revision hip replacement essentially means a redo hip replacement. That means when a hip replacement has gone wrong, or something is started to wear out, or there's a problem such as an infection or a complication relating to the hip replacement. And a revision hip replacement or a redo hip replacement involves redoing some part of or all of the hip replacement that's already in place. There are no real hard and fast criteria as to who needs or when to have a hip replacement. The key question is when your symptoms are bad enough, i.e. your pain is bad enough from the arthritis that you're willing to undergo the risks of the surgery. Now, the risks of a hip replacement surgery are incredibly rare. The highest of all the risks is infection, that's about 1%. And the question for patients is when their symptoms are bad enough, their pain or their stiffness is bad enough, that they feel that their quality of life has been impaired enough to justify going ahead with the surgery and the risks. And that can be from any age. For many hip replacements, the youngest patient I performed a hip replacement on is 14 years old, and the oldest is 95. So that shows the spectrum of patients that can undergo hip replacement. But obviously, when you meet your consultant or you meet your surgeon, we will go through all the pros and cons and counsel you appropriately to make sure that we're both ready to proceed with your hip replacement. The question of how long hip replacement lasts is very difficult to answer on behalf of the whole population. We know that in England, we keep the National Joint Registry, which records every hip replacement that's put in. And we know that how long a hip replacement lasts really depends on the implants that someone uses or a surgeon uses. I can only speak for our data here in Exeter, which suggests that hip replacements last a very long time. And we know in Exeter, 90% of our hip replacements last 25 years or more. And those results are really isolated to Exeter. Some other departments have some excellent results also, but I can't really comment on other surgeons or other centres' results. But we know in Exeter that with the implants that we use and the techniques that we use, our hip replacements last an exceptional amount of time. And most of them, as I said, over 90% last 25 years or more. So there's lots of different ways that a hip replacement can differ between centres. The first way is the type of approach that's used. That's the type of muscles that are cut. That can be varied. The two common approaches are something called the posterior approach or the anterior approach. Both have benefits and risks associated with them, risks of damage to muscles or nerves, and really both have shown equivalent results in the literature. In my practice, I use a posterior approach. I'm able to do a minimally invasive posterior approach, saving some of the muscles that normally a lot of surgeons cut. And the same goes for my colleagues here in Exeter too. The benefit of the posterior approach means I get good exposure of the hip replacement and the hip itself, which allows me to perform complex surgery if needed, or in fact redo surgery as needed. And I find this approach gives me the benefit of exposure and safely being able to put in the components, while also avoiding damage to some of the muscles around the hip called the abductor muscles, which are incredibly important. And these approaches have really been around for a long time now, and we've managed to perfect these techniques to spare muscles, to save cutting some muscles. The newest techniques involve the robot, and here in Exeter we're really lucky to have the Mako robot, which some of you may or may not have heard of, which allows us to accurately implant the implants and the components that we use. Now, the one mistake people think is that the robot actually is doing the surgery. The surgeon is still in complete control, and I would be in complete control of the operation. The robot is merely another check for me to allow me to ensure that I put the components in the right place. I liken it to a spirit level. When I'm putting up a shelf at home using my eyesight, I can sometimes be a degree or two off. The spirit level eliminates that degree of error, and that's what the robot does too. So in terms of bearing surfaces of hip replacements, there's a lot of information out there now. There's various different options. One is ceramic on ceramic, which is a very hard bearing surface and often was thought to be very, very good for younger patients. The problem with the ceramic on ceramic bearing was that it could cause problems such as squeaking, or very rarely could cause fracture of the ceramic because it's a very brittle substance, and that could cause lots of problems. In my practice, I think a lot of my colleagues in the UK, we now go for younger patients, we use a ceramic ball and we use a highly cross-linked plastic liner. And we know that the wear rates are very similar to ceramic on ceramic, but avoiding the problems of fracture and squeaking that were associated with ceramic on ceramic. That's generally tends to be for younger patients below the age of 60 to 70. Above 70, all the results in the national literature seem to show that a highly cross-linked plastic liner with a metal stainless steel head seem to be better. Titanium generally is one of the makes of material that is used to make a hip replacement. For example, the sockets or the cups that we use to replace the socket, the uncemented component is made of titanium. So hopefully a hip replacement won't wear out for a long time. As we said in Exeter, the results are pretty good for lasting over 25 years, or over 90%. When they wear out, generally patients tend to get pain or discomfort, sometimes stiffness associated with the wearing out, and very rarely at the end spectrum, they get dislocation where the hip can pop out of joint because it's not contained within its socket. Thankfully, that's rare, but when it does, it often necessitates redo or revision surgery. Thankfully, the implants that I use in Exeter and my colleagues use in Exeter are implants that are very easy to redo. And so that actually is not a big operation with the implants that we use if one of our hip replacement wears out. As I said, our hip replacements tend to last for a long, long time, but often if they're 30, 40 years old, they often need redo surgery. And that does involve revision surgery, which technically is more challenging for the surgeon and also for the patient to recover from. But that's something that can definitely be achieved and performed.